Hi everybody, it's Dr. Choi here from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and I wanted to make a video today talking about the snap-in denture, how it works, all the little parts associated with it to see how it truly works within your mouth. First of all, I'd like to say that if you could do me a favor, give us a follow on our YouTube channel, and also if you find this content useful, please give us a thumbs up. All right, so basically you're probably looking at a snap-in denture because, and also these dentures have many different names. It's called technically called an implant supported overdenture, a snap-in denture, snap-on denture. So it has many different names. But you're probably interested in this product because either you are in traditional dentures today and you're frustrated with the, many things, right? The inability to taste foods well, the denture rocking all over your mouth when you're talking, eating, embarrassment issues, all these things. Or maybe you have bad teeth and you know that you're going to be in dentures and you're not looking forward to having a traditional denture. So just wanted to explain real quick why this is a superior product versus a traditional denture. So how does a snap-in denture work? Well, this right here you see is might look like a traditional denture, but underneath, behind the scenes, you can actually see coming out through your gums, you got these little attachments, and also on the underside of the denture, you have other attachments that allow this denture to basically snap into place and really get that retention and stability that we're talking about. That's just a nightmare that you have with traditional dentures. So I wanted to basically say, all right, so how does a snap-in denture really work? All right, so I want to show you this here real quick. This is a profile view, basically when we're looking at it from the side. And what we have is, excuse me, in your bone, what we're going to do is we're going to place a titanium implant, okay? We're going to place this titanium implant, and this is the foundation upon which your whole snap-in denture is going to work, okay? Coming through your gums, that's attached to your dental implant, we screw this in. This is what we call the locator abutment, okay? And to just show you here on this model, that would be these little gold pieces, these projections, okay? So attached, again, this is attached at the top of the dental implant, which is buried in your bone, and this protrudes through your gums, okay? All right, now this serves as the attachment upon which these little inserts can then snap into. Okay, you heard that little snapping there. All right, so let's look at this profile view again. This is the locator attachment. Again, this is the piece that goes through your gums. All right, so this piece here, this blue piece here, and this housing right here, and this is the denture. This part from the blue up is all part of the underside of the denture, okay? So when I look at this model again, all that you see, actually this is blue too. It's kind of hard to see in this lighting, but on the underside of this denture you do see the blue housing, okay? Those are what we call the little nylon inserts, and those engage these little gold attachments, okay? So let me show you another view too. So basically, Zest locators are like one of the biggest manufacturers for these locator attachments. Again, this is the dental implant, this is a locator abutment, and then also the inserts, right? So these little inserts, they come in different colors. So why do we have them in different colors? Again, these are on the underside of the denture that snaps into this, which is protruding through your gums. But they come in different colors because you see the 1 pound, 1.5 pounds, 3 pounds. They come in different colors because they have basically, this is basically what gives the strength of the attachment, like how strong this binds. So the stronger the attachment, therefore it's going to use more pressure to take that denture off, okay? So when I give you an example, just kind of switching back here, if I have a clear or a pink attachment, it's going to be harder for me to remove this denture, okay? If I have the other less powerful attachments, then it's going to be really easy to snap off the denture. So we can actually control that by changing the colors of those nylon inserts. So if you want one that's going to be gripping really strong and it's never going to come off, but at the same time, when you're taking it off at night, or if you want to clean or something like that, when people are getting under there, putting their fingers underneath there and trying to take this off, sometimes patients could get a little frustrated because they're like, and it takes them like a minute to take it off, and it's really frustrating for them. If that's you, then you probably need to use maybe like a weaker binding attachment. So we can do that for you. Now those nylon inserts are again made of nylon, so they do wear over time. So you do need to get those replaced, maybe like every 3 to 6 months, 9 months, everybody's different. So basically that's it. That just pretty much explains, essentially this is just a denture that we drilled out little holes underneath and put the little housing and the little nylon inserts to, which allow us to attach onto the locator abutment attachment that's protruding out through your gums. Obviously that has to be anchored by your dental implant, but that's how a snap-in denture works. Now you can see basically, kind of like all the little parts that involve with that. So if you have any questions, please feel free to leave a YouTube comment below and I'll be happy to answer any questions. Hopefully you guys found that video useful. Thank you.